Hey everyone, welcome to Med Nuggets. Today we will be discussing about Wernicke's encephalopathy. What is Wernicke's encephalopathy? It is an acute neuropsychiatric condition occurring due to the deficiency of vitamin B1 or thiamine. It is reversible initially, but if left untreated, can lead to a chronic, irreversible course of psychosis. Let us talk about thiamine first. It is a water-soluble vitamin like all the other B and C vitamins. One of its major roles is in the formation of coenzyme TPP, that is thiamine pyrophosphate, which is required for the formation of energy in the form of ATP via the Krebs cycle or the HMP shunt pathway. It also has an additional role in neuronal conduction. The main sources of thiamine include unpolished rice, cereals, grains, beans, liver, meat, and eggs. It is almost absent in milled rice and grains, so people with mainly rice-based diets are more deficiency prone. The causes of deficiency can be divided into four parts. Part 1 is lack of intake, like in people consuming milled rice or grains or consuming tea, coffee, which are high in anti-thiamine factor. Alcoholics are more prone due to the decreased absorption of thiamine from the gastrointestinal tract and also due to the liver damage caused by alcohol. Vitamin storage in the liver is also decreased. The second is increased demand, like it occurs in pregnancy, lactation, hyperthyroidism, etc. Then increased losses as occurs in diarrhea, diuretic use, etc. Then decreased absorption as occurs in chronic intestinal disease, alcoholism, malnutrition, malabsorption syndromes like celiac and tropical sprue. Let us now talk about the result of thiamine deficiency. What happens is that the neuronal cells, which are mostly glucose dependent for the ATP demands, get starved of energy. Due to the anaerobic respiration, pyruvic acid and lactic acid accumulate, which being potent vasodilators lead to increased cardiac output. This results in a large array of clinical syndromes, namely beriberi, Wernicke's encephalopathy, Korsakoff syndrome to name a few. This video will focus on Wernicke's encephalopathy. So the clinical features of Wernicke encephalopathy can be summed up in a nice mnemonic. GOA, GOA, which stands for global confusion. The patient is disoriented, inattentive, and confused and is usually the most common presentation. If untreated, it can rapidly lead to stupor, coma, and even death of the patient. That's why it is a medical emergency. O stands for ophthalmoplegia. Opthal means eye and plegia means paralysis. So it's the paralysis of the eye muscles. Nystagmus, lateral rectus palsy, and conjugate case palsy may ensue. After treatment, the ocular function is usually the first to be regained. A stands for ataxia. This happens because of polyneuropathy or cerebellar involvement. Usually, ataxia may persist even after treatment in some patients. It is important to note that usually the triad is only seen in a large minority of patients only. For the diagnosis, the blood levels of thiamine or transketolase activity in the RBCs is seen. Transketolase is an important enzyme for HMP shunt pathway. Its synthesis is also dependent on thiamine and its activity decreases in deficiency. But for most part, a clinical diagnosis based upon the symptoms is usually done. For the treatment, it is a medical emergency and should be treated as soon as possible. It includes high doses as high as 500 mg parenterally, preferably IV, for 2 to 3 days and 2 to 3 times a day for 1 to 2 days, and usually followed by 250 mg parenterally for 5 days further. Pabrinex is a combination of vitamin B and C and can be used for prevention of Wernicke's encephalopathy in alcoholics for rapid therapy. Magnesium also acts as a cofactor in many thiamine-dependent enzymes and should be supplemented. IV glucose, if required in the patient, should always be given with thiamine as it precipitates Wernicke's encephalopathy. Thanks for watching. I hope this video was helpful and I'll see you in the next one.